Now, for a closer look at the pandemic in Europe and the state of healthcare there, I'm joined by Mark Seddon in London. Mark is a journalist and a speechwriter. He was also a media advisor to the President of the UN General Assembly. Thank you for joining me.
Thank you, Rachelle.
So let's start with the prevalence of the universal healthcare systems in Europe, for example, in the UK. Just how widespread is that system, and does the virus put them under more or less pressure?
Well, there's a national health service in this country. It's social insurance. It was set up at the end of the Second World War, but really, I think, the antecedents to all of this and the idea for social insurance came as a result of the Spanish flu in 1918 and the response to the pandemic then. It was seen that it was very important to have a healthcare system for all that was free at the point of use. And that is the case in Britain. Now, it has been badly underfunded for the past 10 years. We've had 10 years of austerity. And as with many other countries, Britain has been caught on the hop, slightly unawares, perhaps not paying close enough attention to what the World Health Organization has been saying about testing, and also perhaps not learning enough from what has been the response in countries such as China and also Korea. But there is a healthcare system here. In the United States, as you know, 44 million people without any health insurance at all, and that makes people very vulnerable. Different systems elsewhere in Europe, but a very powerful public component in Germany, France, Spain, and Italy.
Now, as you mentioned, though, despite being a unified bloc, EU countries are each approaching their health response differently when it comes to testing and supply chains and things. Are some countries handling this better than others?
Well, look, I'm not an expert. I mean, like everybody else, you have to kind of learn as you go along. But I've worked for the United Nations, and I've watched how the Ebola crisis unfolded, how also the threats of other possible pandemics. So the avian flu is another case in point. And so I watched this quite early on, and was I think, like everybody else, was very concerned. And yes, there has been a different approach in different countries in Europe. Sweden, for instance, is kind of essentially saying, well, you only have to self-isolate if you're showing symptoms. The different countries are being affected in different ways, it would seem. In Italy, being particularly hard hit, I've listened to various experts talk about the Italian situation. They say that Italy has got the second oldest population in the world. Also close-knit families, big family units living together.
Right.
And this goes back once again to the World Health Organization advice: test, test, and test in order to isolate. And you're not isolating people if you're having them in big family groups in cramped conditions.
And we know that in terms of testing, that German researchers are preparing a mass study into how many people are already immune to the COVID-19 virus so that they could be excluded from restrictions and actually return to work. So what's your take on plans for so-called immunity certificates or immunity passports?
Well, I read that today, and some of the behavioural scientists in this country who did influence also the British Prime Minister over this issue of herd immunity, essentially let it spread in order for immunity to build up, and that others believe lost Britain a month of February, not being better prepared. But they are saying in connection with that is there could be a slight danger with that, because you give somebody a certificate and say, okay, I've had it, I'm fine, they're able to wander about and carry on life as normal. Well, that might tempt other people to say, well, I've had, they could pretend to have, they could falsify documents, they could be out and about saying, well, I've had it as well. And you kind of break this national and community observance of quarantine. I mean, here in this country, 7 days into a lockdown now, we're all experiencing this for the first time. It is quite extraordinary, but there's an enormous amount of community solidarity, not only for protecting one's own family, but people as a whole. And I think there's a little bit of concern about you can see this, you can see the arguments for it, but
Right.
also the dangers.
And speaking of extraordinary measures, we saw that they're now recruiting retired medical professionals in the UK and elsewhere. Now, we know they have the expertise, but also given their age, they also could be the most vulnerable. What are your thoughts on this strategy?
Well, look, I mean, the reality is that a lot of health service staff and frontline health workers have not been tested. My wife is a health worker, and they've been arguing for some weeks now. We need to be tested. Now, this testing is beginning to happen, but so health workers could be going in possibly with COVID-19 or possibly catching it from their patients and taking it back home. So it's not just a risk for older staff coming back out of retirement, but of course, there's a problem if you're not testing people and people are being told to self-isolate because they might have got the symptoms, that you're losing perhaps 20% of the workforce. So the National Health Service at the moment is certainly down on staff. So we can understand why they're doing it. There is a risk for all health staff, whilst there isn't proper testing. But on the plus side, literally, people said, "Oh, nobody could be like the Chinese and build a hospital within a week." But within a week, virtually 2 weeks, there's a 4,000-bed hospital coming into existence in London, the NHS Nightingale Hospital, similar hospitals in Birmingham and in Manchester, Midlands and northern cities. So there's good parts of the response. Right. And poorer parts of the response. And protective equipment is another key issue, not just in Britain, but in other countries too.
Well, wishing your wife and other frontline health workers a lot of safety there. Thank you so much. Mark Seddon there, journalist, speechwriter and former media advisor to the President of the UN General Assembly.